Good morning, and thank you for joining us for Leading Age Maryland Stand-Up. Happy Thursday, everyone. I'm looking forward to our guest speaker today, Shari Solomon from CleanHealth Environmental, and I will hand things over to her. Shari, thank you so much for joining us today. Appreciate it.
Thanks, Sarah. It's a pleasure to be here. Good morning, everyone. Happy to be here today to talk with you about a new enforcement effort that was just recently published by the Occupational Safety and Health Administration. So we have a lot to cover. I will go ahead and get started. Just real briefly about my background, I'm an attorney by trade focusing on environmental health and safety. And so this is precisely what we do to help different types of long-term care facilities and hospitals ensure that they are in compliance. So as we know, back in June of 2021, there was the OSHA Emergency Temporary Standard that was passed, and that was applicable to healthcare facilities in particular. On July 7th, that was updated with the national notification of the National Emphasis Program. And then on December 21st, the rule expired because it's a six-month rule when it's an emergency temporary standard, but only in part did it actually expire. There are certain provisions that are still standing and still requiring enforcement. So what's happening as far as the OSHA emergency temporary standards surrounding COVID-19 is that there are now proposed permanent OSHA regulations that are coming down the pike. And currently it is under White House review with the Office of Information and Regulatory Affairs, which is typically one of the last steps before the regulations are enacted. So keep in mind that it is looking likely that there will be a permanent OSHA standard in place for healthcare facilities surrounding worker protection and COVID-19. So with this new announcement that was just announced on March 8th, they have announced a new focused enhanced inspection. And these focused inspections are going to occur from March 9th. So we're already in that window through June 9th. So there's a 3-month window where they are going to be revisiting healthcare facilities and looking to confirm compliance with the emergency temporary standard, as well as with a number of other OSHA regulations that you need to ensure that you have in place and you are being in compliance. So this applies to hospitals, to skilled nursing facilities, and to assisted living facilities as well. This enhanced, focused, new inspection procedure that they have just announced. As far as the selection process, there are specific types of facilities that they are going to be focusing on. Those facilities where there are follow-up inspections of any prior inspection in which there was a COVID-related citation or hazard and a letter was issued. Those facilities regarding follow-up or monitoring inspections for randomly selected closed COVID-19 unplanned activities, including COVID-19 compliance and rapid response investigations, or they will be selecting those monitoring inspections for randomly selected remote-only COVID-19 inspections for which COVID-19 related citations were previously issued. So looking at those folks that had already some issues and compliance challenges, that is the facilities they are going to be focusing on. So as far as the on-site inspection, the intention is to conduct the inspections that currently treat or handle known COVID-19 patients. If the facility demonstrates that it does not treat or handle COVID-19, the inspection will be closed as records only. However, and the important however at the bottom, if the facility transfers patients or residents exhibiting symptoms of COVID-19 off-site, it will still be subject to an on-site inspection. As far as the role and the focus of the on-site inspection, in addition to the field operations manual and the COVID-19 enhancement program that was published in June of 2021, they will be determining if the previous COVID-19 related violations or complaints have been corrected. So that's one thing they'll be focusing on. They'll be determining if an adequate COVID-19 plan has been implemented. And I'm going to go through each of these briefly and ensure that you have these in place. So we're looking to make sure that you've corrected all of your COVID-19 violations from the past. You have your COVID-19 plan implemented. So not only a written document, but also verification that it is being implemented in some manner. Verifying the existence and effectiveness of all control measures, including procedures for determining vaccination status. And they'll be doing that by reviewing your relevant records pertaining to that. And they also will be referring any vaccination-related deficiencies to CMS. In addition, as part of the on-site inspection, what precisely they will be looking for and looking at. First, the COVID-19 log and injury and illness log. So we know under OSHA, there is a requirement under your OSHA 300 log and 301 incident reports to have documented identifying work-related cases of COVID. So making sure you have your OSHA logs updated and your OSHA 301 incident reports updated as well. Reviewing the facility's procedures for conducting hazard assessments, making sure you've conducted your hazard assessment, you have documented that you have conducted it and what you have arrived at as far as your determination to mitigate those risks, as well as your protocols for using proper personal protective equipment. In addition to your general personal protective equipment, they'll also be looking at your respiratory protection program. And this is something of specific focus. There is a number of requirements under your respiratory protection program, which includes fit testing, medical evaluations, training records. So you want to make sure that you have your respiratory protection program up to date, and also that you're doing your annual fit testing as required by the regulation and your training as well. The on-site inspection will also include a limited focused walk around of areas designated for COVID-19 patient treatment or handling, and expect that they will be performing employee interviews to determine compliance, because really the best way that they can verify if your programs that you have written and in place are being complied with is to validate that through your workers, who should understand and recognize the requirements of that program. So as OSHA highlights, in addition to the COVID-19 procedures, you also need to recognize that there are already a number of OSHA programs already in place that you need to make sure that you're adhering to. And they do reference that when they do their walkthrough, it will be a focused walkthrough, but if there are any visual obvious issues beyond that that are in violation of OSHA, they will most definitely make a note of that as well. So we know in general, we have responsibility as the employer to protect the employee under the general duty clause. We call that the catch-all clause. And that states a place of employment which is free from recognized hazards that are causing or likely to cause death or serious harm to his employees. So we know that we have the general responsibility to protect our employees. In addition to the general duty clause, there are a number of additional OSHA requirements that the additional enforcement and inspections will be focusing upon. And this is right from the OSHA notice. Recording and reporting of your occupational injuries and illness, your personal protective equipment requirements, your respiratory protection requirements, access to employee exposure and medical records, and then of course the healthcare emergency temporary standard COVID-19 record keeping and reporting. The last bullet, that was the one provision of the emergency OSHA and temporary standard that was not, did not go away in December of 2021. However, what OSHA has made clear is that these OSHA requirements, although they're no longer part of the emergency temporary standard, are still required that you adhere to them, because these are general OSHA requirements that have always been required. And so they will be focusing on PPE, on respiratory protection, on conducting your hazard assessment as well. So to briefly go through what they're going to be looking for is, as we just stated, your COVID-19 prevention plan. That is a written plan. You conduct your hazard risk assessment, determine proper engineering and administrative controls, worker protection, enhanced cleaning, vaccination policies, and so on and so forth. So that COVID-19 prevention plan, they will be specifically looking for and ensuring not only do you have it, but that you are complying with it and is being implemented. So part of implementing that plan is performing your hazard risk assessment, determining the risk, and identifying how to mitigate that risk. That will define your personal protective equipment, your respiratory protection, your vaccination status, etc. Also, as we just shared, the respiratory protection standard, you must have that in place. That includes a written medical evaluation, fit testing, which needs to be done annually, initially and annually, a program with worksite specific procedures, and effective training on the plan. So we know that OSHA is out in full force. Just as an FYI, here is a list of the most frequently cited OSHA violations. So we see respiratory protection right there on top. Record keeping obviously has become more of an issue, especially that it was not removed from the requirements under the emergency temporary standard. And so keep this in mind. It's not only about the OSHA COVID standards, but it's also about your other OSHA protections for your workers. So what can you do to prepare for an inspection? First of all, you want to review your programs, your respiratory protection program, your personal protective equipment program, your record keeping program, your COVID program, and make sure that these are in place, that they're effective, that they're being complied with, and that your workers understand what their requirements are. Because if OSHA comes on site, they will be interviewing your workers. So the training component is essential. Review or create a facility plan for unannounced on-site inspection. So not only is this an opportunity to prepare your plans, but do you have a facility plan for unannounced on-site inspections? If so, you probably want to dust that off and take a look at it. And so you want to make sure before OSHA arrives, you know who will greet the inspector, accompany the inspector during the walkthrough, take notes and document the inspection, and be in charge of responding and providing documents to the inspector. So knowing what your procedure is, and that first impression of how you greet that OSHA inspector, who's going to walk them around, how are you going to organize that inspection, really is key to ensuring that you're going to have hopefully a successful inspection procedure. So with that, it looks like I've stayed under my 15-minute mark here. CleanHealth Environmental is more than happy to be a resource for you. We do OSHA compliance audits, help you develop the programs, do OSHA training. And so if there's anything that we can do to help, please do not hesitate to contact us. We're also happy to share our PowerPoint presentation and share the recording of this session. If you would like to share that with your colleagues, please feel free. And with that, I will thank you for your time and I will pass it back to Sarah.
Thank you, Shari. Appreciate you joining us this morning and hope everybody has a great rest of the day.